And the importance really of what the immune system does in head and neck cancer was emphasised to me a few years ago when we performed a study to try and understand why we get better survival in head and neck cancers that are driven by HPV virus. So in the UK, somewhere between about 30 to 50% of cancers are HPV driven, virally driven, and you find those cancers situated around the base of the tongue and in the oropharynx. And it's a really interesting disease because most of these patients present with metastasis in their lymph nodes in the neck. And if you consider HPV negative disease, that's a really bad prognostic sign. But most HPV positive cancers, patients with the cancers do very well, as you can see from the Kaplan-Meier survival curve, where we've analysed several hundred patients from our region. And really the premise of the project was trying to understand why these patients were surviving better. And really, the way that checkpoint inhibitors work, they're predicated on boosting a pre-existing anti-tumour immune response. So I suppose point one, if we're considering giving a patient this type of drug, then as pathologists we should probably be commenting on this morphological tumour feature. Are there lots of lymphocytes in this tumour, as well as when we move on to do our PD-L1 staining. PD-L1 testing precision-ish, we've emphasised today just how complicated it's becoming. Different drugs associated with different antibodies for the tests, different platforms, different cutoffs, different cell scores, different algorithms. Biologically, I could never really quite understand, when you consider how PD-1 works, it can bind to two receptors, PD-L1 and PD-L2, why the focus has always been on PD-L1. But we can see from the sort of expression that we find in tumours that it's quite heterogeneous. So if you're taking a small biopsy, you take the wrong part of the tumour, you may get a negative result. And indeed, up to about 15% of patients that test negative will respond to this type of drug. So it's imprecise both from a negative predictive value and a positive predictive value.